Welcome back to the Austin Physio YouTube channel. Today's quick routine is all about helping with stiffness and tightness around the elbow joint. So what's really common if we're using the elbow day to day, or we've got any underlying potential wear and tear or soreness in the humeral or ulnar joint, so up through here, this can lead to restriction, limitation on certain movements and pain and tenderness. So for our 2-minute video today, it's all about moving, stretching and relaxing all around this area to help with the pain and soreness. So for the first 15 seconds, we want to try and encourage a little bit of normal movement through the elbow joint. So where it's a hinge joint, we want to be bending and straightening the elbow. So if you're someone who's struggling with underlying wear and tear or soreness into here, you're going to be quite limited on movement. So we're looking for quality, not quantity. So we want to move that for 15 seconds and then we want to turn up and back. So although this is looking at more that radial ulnar joint, we want to get in that optimal mobility. So we're going to do pronation and supination for 15 seconds, relaxing around this elbow. Next, we want to look at softening into the muscles. So what we can start to do is 15 seconds massage into the forearm muscles. So before we go into stretching, we want to do circular motions on the outside and then circular motions on the inside. So we want to get blood flow into the area for 15 seconds, relaxing through. Next, we want to target the extensors and the supinators. So we're going to turn the hand over and stretch the hand forward, holding that for 15 seconds. We want to stretch through here. Really important to relax around the muscles to impact that mobility into the elbow joint. 15 seconds, we want to stretch through the flexors and the pronators. So we're going to turn the hand over and stretch the arm out in front. So we want to hold this for 15 seconds. So if you're thinking that there's stiffness and soreness into the joint, if you can release around the main muscles, that can massively help with that flexibility and movement. For the next 15 seconds, we want to stretch into your triceps muscles. So free head of the triceps muscle attaching from the back of the shoulder all the way towards the elbow. So if there's any tightness in there, it's going to be impacting that stability and movement through the elbow joint. So to stretch the triceps, what we're going to do is place hand on the back of the shoulder. So for a lot of people, this might be enough of a stretch. If you want to exaggerate the stretch, holding over the back of the elbow and pulling the arm upwards. We should be feeling it down the back of the arm here, and we want to aim to hold that for 15 seconds, so holding that position there. Good. For the final 15 seconds, we're going to stretch into the bicep. So if we've got a wall or a fridge or something stable that you can hold on to, keeping the arm level. Yes, this will be stretching into your pec as well, but you're also stretching into that bicep. So by keeping the arm flat, you're going to turn the body away and you should feel it with the straight arm. Pull into the bicep, into the chest, and then to exaggerate the stretch, you can push into the wall or the fridge that you're holding onto to feel more of an exaggerated stretch through there. And again, holding that for 15 seconds to stretch around the front. And the reason why we want to stretch through the bicep as well is the bicep blending down into an aponeurosis around the elbow here. So any tightness into the biceps or the triceps, the forearm muscles, or any restriction into the joint itself is going to add to these symptoms. So what we would recommend with this routine is adding it in once or twice per week to encourage movement and stretching into the elbow, but most importantly, getting your symptoms assessed by a musculoskeletal expert first to find the right diagnosis and treatment plan for you, and to make sure that these exercises are relevant for your specific symptoms.